color caused by the Malassezia globosa. It is caused by the Malassezia globosa. It infects stratum corneum. It infects stratum corneum. The most common site is the upper trunk. The most common site is the upper trunk. What you will see perifollicular hypopigmentation. You will see perifollicular hypopigmentation is the classical feature. The reason of perifollicular hypopigmentation is that Malassezia fungus secrete azelaic acid. It secrete azelaic acid, and this azelaic acid inhibit tyrosinase enzyme. These inhibit the tyrosinase enzyme. Because the tyrosinase enzyme is inhibited, patient will have a hypopigmented lesion. The lesion will be hypopigmented. Scratch sign is positive. Scratch sign is positive. So what is this positive? So when you scratch this, it is a hypopigmented macula. As you can see in this image, all these hypopigmented maculae will coalesce with each other and will make a large hypopigmented patch. But when I will scratch, so as I told, on scratching, what will happen? My stratum corneum will come on my skin. So when I will scratch, it will give me a powdery feeling that on skin, I can feel that the stratum corneum is coming like a powdery flakes. So what is this scale? This scale is a powdery fine scale. And remember, this rash is non-itchy. Rash is non-itchy. This rash is non-itchy. So, as I told you, that most of the feature is a hypopigmentation. Hypopigmentation is most commonly seen, but in one MCQ, it was given that the feature of pityriasis versicolor can be hyperpigmentation also. Can be hyperpigmentation also. Why? Because in a fair-skinned person, if person is a fair skin, this fungus stimulate the melanocyte. And because of this, you will see hyperpigmentation. It will cause hyperpigmentation. So you will remember in pityriasis, versicolor, and most of the students make mistake. We will discuss two important diseases: pityriasis versicolor and pityriasis rosea. So pityriasis versicolor is a disorder with a hyperpigmentation or can be with a hyperpigmentation. Remember, this fungus is not a pathogenic fungus. We all have a Malassezia fungus on our body, but it is not in an outnumber because other bacteria and fungus keep their population in check, and because of this, they are not producing disease in a normal person. But when we are going into the humid environment, what will happen on our skin? If the fungus is increasing because of the outer environment, it will cause the disease. It will cause the disease. Now, anyone know what is this fungus, Malassezia fungus? This is a dimorphic fungus. So, what is the meaning of dimorphic fungus? It has a two form. Which are the two forms? The one form is a yeast form, and the other form is the hyphae form. So, you will see two kind of forms in this. This is the round yeast form, and this is the hyphae form. So that is why on a KOH examination in the diagnosis, this MCQ multiple times has been asked. It is a spaghetti and a meatball appearance. This image-based question has been asked multiple times. On a woodland, it will give a pale yellow. It will give me pale yellow fluorescence. It will give pale yellow fluorescence. Okay. एग्जाम 12 को 13 को 12 को है ना ऑलमोस्ट 55-54 मैं तो नहीं कर सकता कोरोना कर सकता है बट लग नहीं रहा है इसका नहीं वो तो कोरोना आएगा तो तुम लोगों को तो लेगी क्योंकि जरूरत है हाँ कोरोना आएगा तो एग्जाम तो लेंगे ही क्योंकि इंटेंस की जरूरत है ओके सो KOH spaghetti and a meatball appearance okay now see this MCQ which is not used in the treatment of pityriasis versicolor so you all know it is a fungus disorder so which is not used in this disorder pityriasis versicolor we do not use griseofulvin. Okay. So right now, drug of choice. First line is a clotrimazole. The clotrimazole. Iconazole. The iconazole. First should be the topical treatment. Okay. In the topical, we commonly use clotrimazole. Oral, what is not used? Griseofulvin, and the terbinafine is not used. Griseofulvin and the terbinafine is not used. The oral drug which can be used, oral drug which can be used is a fluconazole, and the itraconazole. Selenium sulfide. When we use selenium sulfide, remember it is a fungi toxic. This lotion is a fungi toxic. Can help it can help in reducing can help. Okay. Second important disease, candidiasis. So which organism causes candidiasis commonly? It is a Candida albicans. It is a Candida albicans. This Candida albicans is a opportunistic infection. This is a opportunistic infection. So it requires some predisposing factor. Otherwise, it cannot infect our body. What can be this? Diabetes and HIV. Why in diabetes? In diabetes, because of the glucose intolerance, patients are predisposed in the candida. If patient has HIV or AIDS, HIV and AIDS, if the patient is having a too much moisture in the environment, this also favors candidiasis. This also favors the candidiasis. If patient is wearing dentures, it can easily cause oral candidiasis. In bronchial asthma, patient who is taking nasal spray, right? So not nasal spray, the spray for the bronchial asthma. So generally what we tell the patient, after taking this spray, gargle 2-3 times. The reason is otherwise they will develop a oral thrush. So steroid use. Any kind of steroid use, but I just give you the example. This can lead to candidiasis. Okay. Coming to what are the different types of the candidiasis. The first is the oropharyngeal candidiasis. Oropharyngeal candidiasis is the commonest It is the commonest fungal infection in the HIV. It is the commonest fungal infection in HIV. Why person will develop candidal intertrigo? Because of the moisture. Because moisture favors the growth of this fungus. Moisture favors the growth. बच्चों में भी होता है. माउथ इन्फेक्शन बच्चों में भी होता है. The moisture favors the growth. Okay. Now, very important, vulvovaginitis. So, what is the most common cause of vulvovaginitis? It is a bacterial. What? क्या कहते हैं उसको? Bacterial vaginosis. Which bacteria causes? It is a Gardnerella vaginalis bacteria. So, we will discuss three important type of the vulvovaginitis. So these questions are commonly asked. Vulvovaginitis. The first disease is the bacterial vaginosis. So see this. The name of this disease is the bacterial vaginosis. It is not vaginitis, vaginosis. So as you can see in this, there is no inflammation. So if they ask you in which vulvovaginitis inflammation is absent, answer is a bacterial vaginosis. It is caused by bacteria Gardnerella vaginalis. Gardnerella vaginalis. One important MCQ they ask is, if I take a epithelial cell from, if I take a scraping from the vaginal cells, on this epithelial cell, I will see many bacteria is present. These cells are known as a clue cells. So many MCQ has been asked on this. Clue cells are seen in a bacterial vaginosis. If you check the pH, it is more than 4.5 alkaline pH. So what is normal? 3.8 to 4.2. Normal is a 3.8 to 4.2. On KOH, so if you take a secretion from the vagina and when you add KOH, what you will notice is there is a positive amine odor. So what is this odor? It is a fishy odor. So they ask this, that the patient is complaining of the fishy odor of the vaginal secretion. What is the drug of choice? Metronidazole. Drug of choice is a metronidazole. This criteria which we discussed, what are these criteria? Clue cell, pH, and the fishy odor on KOH, which is a positive amine odor. These criteria is a Amsel's criteria. Amsel's criteria. So all are the important MCQ previously asked on this topic, bacterial vaginosis. As I told, it is a vaginosis, no vaginitis, no inflammation. Second is trichomoniasis. Trichomoniasis. In this patient will have a yellowish green. Patient will have a yellow-green discharge. Plus, patient will have a vaginal inflammation. Patient will have a vaginal inflammation. pH is also will be alkaline here, more than 4.5. And what you will notice, motile trichomonas present. Motile trichomonas present. What is the drug of choice for the trichomoniasis? Metronidazole. But what is the peculiarity of this disease? That male and female both have to be treated. Male and female both should get treated. Third is a Candida vaginitis. Candida vulvovaginitis. In this, patient will have a thick white discharge. Patient will have a thick white discharge. Inflammation will be present. But what you will notice, pH will be of the normal range. So this is the differentiating feature of Candida vulvovaginitis. You will notice pseudo hyphae. You will see pseudo hyphae. The drug of choice is a fluconazole. Drug of choice is a fluconazole. So blue cells, remember the normal pH. Many times you will ask a yellow-green discharge. Yellow-green discharge, and a female will also be complaining of the itching because inflammation is present in the vulvovagina. These are the important features, and they ask question on this. If I say most common vulvovaginitis, it is a bacterial. Second most common is a Candida. Second most common is a Candida. Okay. Now, what is candidal balanitis? So, it is an infection of the glands penis. So, in your exam, once the MCQ was asked that a 40-year-old male person is having a recurrent infection on his glands penis because of the candida, what should be the next step in this patient? So, next step in this patient should be to look for underlying diabetes mellitus. Okay, So this was the MCQ which was asked. If the person is having a recurrent new onset infection, so might be the patient is having a underlying diabetes. So because this MCQ was asked initially, so look for diabetes mellitus, because might be this person is not diagnosed and constantly having a hyperglycemia, which can lead to candidal balanitis. Candidal paronychia, because of constant wetting of the hand and the housework, what is happening? Fungus can go inside the nail plate and cause candidal paronychia. So what is the meaning of paronychia? Paronychia means, so when I have an infection in this area is known as a paronychium of the proximal nail fold. So this paronychia is a chronic. This paronychia is a chronic paronychia. It is chronic paronychia. But if I change the question, if I ask what is the causative agent of the acute paronychia, answer is a Staphylococcus aureus. Answer is a Staphylococcus aureus in case of acute paronychia. Okay, so totally how you will, what is the drug of choice for the candidiasis? It is a fluconazole. Drug of choice is a in candida infection, it is always the fluconazole. Remember here also, rhizophulvin is not effective. Rhizophulvin is not effective against the candida. Okay. So दो जगह पे rhizophulvin आंसर नहीं करना है, pityriasis, versicolor और candida. Rhizophulvin और terbinafine को आंसर नहीं करना है. Okay. See this. So in your exam, if they give you a nail with the infection of the proximal nail fold, as you can see here, proximal or the lateral nail fold. So what is this? This is a perionychium, and the infection of this is known as a paronychia. So infection of the proximal and lateral nail fold is known as a paronychia. If they ask acute, it is a Staphylococcus aureus. If they ask chronic, it is a candida. Next topic is a tinea or the ringworm. Tinea or the ringworm. So tinea and the ringworm, it is very common in our population, right? It is very common in our population. Why it is known as a ringworm? It is causing the annular lesion with peripheral scale. Why peripheral scale? I will have a itching only in the peripheral area mainly. So suppose I have an infection here. So the main fungus will be here, but someone will start going outside. Why actually this fungus infect our skin? They want to eat keratin. They are the keratophilic fungus, and the corneum has the highest amount of keratin. So what they are doing is they are eating our keratin. So when there is so much fungus, my immunity is not trying to kill that fungus, but the fungus which are going in the outer direction, my immunity is trying to limit that fungus going outside, and because of that, the most of the time I will itch this area, and because of this, what will happen? What is the meaning of scale? I am itching out, and because of the damaged skin will be in a annular fashion. This skin will get damaged because I have a round itching, and because of this, in the central area, what you will see this word, there is a central clearing and the annular scale, because you are not itching in the center. These words, mark this word, because in MCQ they will use this word, that annular lesion with a central clearing, it is a tinea, ringworm, or a dermatophytosis. So these all are the same disease, dermatophytosis. So they can use tinea word or a dermatophytosis word. These are the keratophilic fungus. So which layer is infected? Stratum. It will infect mainly the stratum corneum. The three species which commonly cause tinea or the ringworm. The first is the trichophyton. So now tell me, what are the keratin containing organs on our body? Hair, nail, and skin. So as you can see, this fungus is a tri. So because this fungus is a tri, it will infect my hair, nail, and skin. Okay, this fungus is infecting all the three structure of my body which contains keratin. Second fungus is the epidermophyton. So E alphabet is nearby H alphabet, right? H and E is nearby. So see this, hair is not involved in the infection caused by the epidermophyton. So how you will remember? H and E is near, so hair is not involved. But which structure is infected with the epidermophyton? It is a nail and the skin. The third is the microsporum. So M alphabet is nearby N alphabet. So nail is not involved in the infection caused by the microsporum. So microsporum will infect my hair and skin. So the MCQ point you should remember is skin is involved in all three. So they can make an MCQ like this: skin involvement is seen in all these fungus except, okay, they will put some third option. So trichophyton, epidermophyton, and microsporum, they will put like this. In epidermophyton, all are infected, but hair are not infected. In microsporum, nail are not infected. And trichophyton, remember from the tri, it infects all. So now tell me, by looking at this, which fungus looks more aggressive? Trichophyton is looking more aggressive. So when we are learning the disease, what we will do, we will understand that the trichophyton is causing the severe disease. The first important disease, which is very important, it is a tinea capitis. In tinea capitis, what we will discuss in our head area, there are two important keratin containing structure, our scalp skin and the hair, both. So what it will do, it will infect our scalp, hair, shaft. So what is this hair shaft? Either they can infect from the outside, so this fungus will mainly here onto my skin. It is eating up keratin like this. So as you can see, this infection is known as the ectothrix infection. So how you will remember the species? That because it is from the outside only, the species is from the microsporum species. But another example, if this fungus is aggressive, this fungus will go inside my hair shaft to eat up its all keratin. It is eating up all this keratin from inside. This infection is an endothrix infection. And because it is an aggressive disease, you can remember the species. It is from the trichophyton species. So remember like this: ectothrix infection, microsporum species; endothrix infection, trichophyton species. This tinea capitis will cause the alopecia. It will cause the alopecia. Two type of alopecia will be there. If it is an inflammatory, it will cause a scarring of the scalp skin. So it is a scarring alopecia. But if non-inflammatory, if it is a non-inflammatory, it is a non-scarring. So if the inflammation is present, it is a scarring alopecia. Non-inflammatory, it was non-scarring alopecia. So as you can see, because of this infection, what will happen in ectothrix infection? Easily hair pluckability will be there, because hair will become very weak. So mother is combing her child's hair and hair is coming out easily. The reason is there is a weakness because of the keratin is eaten up by the fungus. So this patient will come to us with the complaint of a hair fall alopecia. So what are the two type of alopecia? Quickly see. See this. The first is a non-inflammatory gray patch alopecia. So generally what MCQ they ask, what is the causative agent of the gray patch alopecia? So in which condition you will see a gray patch, in which condition you will see the black dot. If you understand this ectothrix and endothrix infection, what will happen when this hair will come out? So let's take an example. When this hair and the in case of the endothrix infection, because the hair shaft is eaten up totally, my hair will get broken half, right? Because hair is eaten up, and now this part is inside the hair follicle. So if I have a area of an infection, if I see from the above, it will look like to this. In an area of a gray patch, what I can see is a gray patch area. There is a total loss. Only skin I can see that it is infected. So it is a gray patch alopecia. So what is the correlation? In gray patch alopecia, what you will see ectotheric infection. By this you will know which species, microsporum species. By the black dot alopecia, you are seeing the black dots. What is the infection? Endothelial infection. Species, trichophyton. So write down non-inflammatory alopecia are two types. Non-inflammatory alopecia. The first is a gray patch. In this gray patch, I will have a ectotheric infection. It is due to microsporum canis. In the black dot, endothelial infection. It is by the trichophyton tonsurans. Trichophyton tonsurans. So as you can see, it is a non-inflammatory. There is no damage to the scalp skin. So it is a non-scarring. So remember, you will see many MCQ being asked, what are the types of the non-scarring alopecia? So these are the two types which cause non-scarring alopecia. Gray patch and the black dot, the non-scarring alopecia. But when I will develop inflammation, if this fungus try to go deeper, then my immunity will take up to kill them. So if this patient do not get treated and if this fungus is going deep and deep, now it will be attacked by my immunity. So what you will notice, you will see the swelling above the skin, right? So this in this NEET exam, last NEET exam, they ask this question, that patient is having a hair fall with easy pluckability along with the boggy swelling on the scalp. What is this alopecia? This alopecia is a carrion. This is known as a carrion. But along with the carrion, now if you see this image, can you appreciate, is it a black dot or a gray patch? No, it is a black dot. Now you see the half broken hairs. Can you see half broken hair? Hair are not totally coming out. So if you see on this area, can you appreciate the hairs are not coming out totally from the follicle? Hairs are the half broken, along which you can see this boggy swelling. So if I ask you what is the causative agent of the carrion, it is a trichophyton produce inflammatory alopecia. The first is a carrion. The first is a carrion. It is a trichophyton mentagrophyte. The positive agent is a trichophyton mentagrophyte. Endothrix infection plus boggy scalp swelling. Boggy scalp swelling. Second is a Phoebus. It is caused by the trichophyton Schonleini. It is caused by the trichophyton Schonleini. It is also caused the endothrix infection. It also causes endothrix infection with yellow cup shape scutula. So this is an extremely severe variant. Scutula. It is a yellow cup shaped scutula. In both these diseases, there will be the scarring of the skin. So carrion and the Phoebus is the example of the scarring alopecia. It will cause scar on the scalp skin. Clear? So non-inflammatory, you will remember gray patch, black dot, inflammatory, carrion and Phoebus. So see this is the inflammatory type Phoebus. Inflammatory type Phoebus. Carrion की photo देख ली थी, boggy swelling, right? What is this Phoebus? Phoebus, as we wrote, yellow cup-shaped scutula, because fungus is eating up all the keratin from the inside and whatever it is receiving from the body. So they are making a large colonies using their keratin, and these colonies are the cup-shaped scutula. These all are the fungal colonies with the keratin. As you see, there is a severe scarring of the scalp skin that no new hair is growing, right? Because of the severe scarring of the skin. Now, coming to the treatment part, what is the treatment? In the microsporum species, which is most commonly called gray patch. So, microsporum causes most commonly gray patch alopecia. And only some type of carrion. Only some type of carrion is caused by the microsporum. Otherwise, carrion is caused by the most commonly trichophyton. In this case, the drug of choice is a griseofulvin. If they ask what is the treatment of choice for the black dot and Phoebus, it is terbinafine. It is terbinafine. But now Now, if in your exam, if they ask, what is a drug of choice? In the tinea capitis, you will answer oral griseofulvin. Okay, because mild variety is most common, and you will try to give oral griseofulvin. But if a person is having a prolonged period of time for many months or year is having the same problem, you can opt for the terbinafine also. It is not contraindicated, but because it is a very strong medicine, you will give it in a case the patient is suffering from the many months or years. Okay. Otherwise, in all tinea capitis, what is the drug of choice? For the ringworm of beard, which is a tinea barbae, or a ringworm cruris. So what is tinea cruris? Known as the chalk itch, Dobie's itch, okay, jock itch or Dobie's itch. In all these diseases, drug of choice is terbinafine. Drug of choice is a terbinafine. Or generally give for more than 8 a patient is taking this terbinafine will get deposit inside the keratinocyte, each keratinocyte, and it will inhibit the entry of the fungus to eat this keratin filament because they want to eat keratin. So, as you all know, epidermis turnover time is the 28 days. So, this treatment duration should always be more than 28 days because all this drug containing keratinocyte comes to the superficial surface, then only the person will get relieved. If you are stopping this medicine, you will not get fully treated. That is why these ringworm are not easily going. Next topic, subcutaneous mycosis. Subcutaneous mycosis. In subcutaneous mycosis, they will give you some clinical history of the patient. The person got this profession is a agent of this. So we will know about this sporotrichosis. The positive agent, this MCQ previously has been asked, what is the positive agent of this sporotrichosis? The fungus is a Sporothrix shanghai. It is also known as Rose Gardner's disease. It is also known as a Rose Gardner's disease. Why? Because rose gardeners pluck their roses after 12 midnight. The reason is they have to sell it fresh during the next morning. So they generally pluck during the night time, and because of the thorns, it hits on their skin. And because of this thorn prick, repeated thorn prick, what they will develop rash. And because of this, it is known as a rose gardener's disease. So they will give you the history like this. The patient developed this rash after the thorn prick. So history of conflict or the profession will be present. Patient has ulcerating nodules plus discharging sinus on the important antibody, which is a asteroid body, not antibody, sorry, asteroid body. In this asteroid body, oval shaped fungus along with the eosinophilic radiation around it. This is known as a asteroid body. This is known as a asteroid body. You will see is plus radiation. East plus eosinophilic radiation. This body is known as the asteroid body. Drug of choice is the itraconazole. Drug of choice is the itraconazole. Okay. So remember this image. How to identify sporotrichosis? Then, because this disease is spread by the lymph node. Wherever the lymph node is present, it is spreading on a line of the lymph node. So you will see the linear chain. Okay, this is the sign of the sporotrichosis. If the lesion is on a linear fashion, you will think of the sporotrichosis. This disease also resembles. This also resembles fish tank granuloma. It also resembles the fish tank granuloma. So see this. So similar photos you will see for the sporotrichosis also. So after the trauma, as you can see, there are linear ulceration along the lymph node. But as I told, I will give you some history that this person is working with the aquarium. So what is the causative agent of fish tank granuloma? Mycobacterium marinum. It is caused by the Mycobacterium marinum. So fish tank granuloma causative agent, Mycobacterium marinum. It is caused by the Mycobacterium marinum. And the drug of choice, most of the students make a mistake. They answer rifampin. Rifampicin is not a drug of choice because it is never answer rifampin in atypical mycobacteria. Okay, we never treat atypical mycobacterium with a rifampicin. It can be easily get treated with the drug minocycline. And if it is in the not in the option, it is second drug can be used with the azithromycin. So Mycobacterium marinum, azithromycin. In HIV, you know Mycobacterium avium complex, right? In that also Mycobacterium avium complex do not answer rifampicin. For that also we use azithromycin. In HIV patient along with the TB, they have a risk of atypical mycobacterial infection. We will treat this disease with the azithromycin. Mycobacterium tuberculosis and the Mycobacterium leprae. These are the two diseases which will require a drug rifampicin. Mycobacterium leprae, Mycobacterium TB. So this is also the same photo as you can see, linear chain of ulcerating nodule and the sinuses. And this is the after the treatment. Now mycetoma. Mycetoma or the Madura foot. Mycetoma or the Madura foot. So in mycetoma or Madura foot, what they will give you? They will give you a finding of this triad. That patient will have a swelling of the foot. They will give you the swelling of the foot. First discharging sinus. And the grains. Now, what is this grain? This is the clump of the pus. So this clump of the pus can be of two colors. It can be a white color. It can be the black color. If we black color grain, what is the causative agent? If the color of the grain is black, you all know when we have a fungus on the wall, what is the color? Black color, right? So when the fungus is infecting a farmer's foot and if the pus is coming out, so generally why we have a pus? Pus are the dead neutrophil. But if it is a infection is caused by some fungus which has a black pigment, the clump which is coming out, or when you made a puncture on the swelling and some pus is coming out, and if this coming out pus has a black color grain in it, means what is the causative agent? Fungal is a cause. If the yellow colored or white colored pus is coming out, means bacteria is the cause. So why this is important is, based on this you will start the treatment. If black color grain is coming out, the treatment will be on the fungal line, otherwise on the bacterial line. That is why this topic become important, and they ask this in black color grain. Mycetoma. This is a U mycetoma. The fungus which caused this disease is a Madurella species. Fungus which causes is a Madurella species. And the treatment fluconazole. And the second is the amphotericin B. रिसेंटली आपने म्यूकरमाइकोसिस के भी फोटो देखे होंगे, है ना, ब्लैक कलर के वो पैच बन जाते. सो इफ इट इज अ वाइट कलर ग्रेन, इट इज अ एक्टिनोमाइसेटोमा. It is caused by the filamentous bacteria. So which are the two filamentous bacteria? So the causative agent can be the either nocardia or it can be the actinomycet. But which will be more common? Actinomycet, because that is the reason the name is given with the actinomycet. So name is given as a actinomycetoma because the most common cause of this is a actinomycet. But remember, nocardia can also cause this. Okay, nocardia can also cause actinomycetoma. So how you will treat? You will treat with the amikacin. Drug of choice is the amikacin. Drug of choice amikacin. Cotrimoxazole. Or you can use rifampicin. Okay. Apart from this, one important MCQ they ask is of botryomicosis. So sometimes students get confused and they answer fungus. But remember, it is a misnomer. The positive agent is a bacteria, which is Staphylococcus aureus. So, botryomicosis is also the swelling of the foot. Okay, it is a swelling of the foot. But positive agent is different. Okay. Now next image-based question. See, a warty cauliflower-like growth. Two important questions on this: how to diagnose this and what is a causative agent. They will give you a image-based question. What is a causative agent? It is a chromoblastomycosis. The fungus is a Pialophora species. Person will have a thorn prick, and after the thorn prick have an appearance like this, which is a warty cauliflower-like mass. Warty cauliflower-like mass. For the diagnosis, on the histopathological examination, you will see these typically copper penny bodies. What you will see? You will see copper penny body. Copper penny body. Or the second name is a sclerotic body. Copper penny body and this sclerotic body. Okay. We will discuss viral diseases. रह गया? स्टॉप करो ना, ये वाला, ये डायरेक्ट इमेज आएगी। एनबी डीएनबी में आई थी 2018 या 17 में। अरे दो ही तो चीज याद रखनी है। इसका ट्रीटमेंट इतना करना चाहिए, इतना करना। अरे आराम से आते जाएगा, डोंट वरी। एवरीडे थोड़ा थोड़ा देखना है। देखो इमेज बेस्ड क्वेश्चन है ना, वो इजी रहते हैं, आपको खाली एक विजुअल फॉर्म करनी है। ऐसा नहीं है कि आज का आज याद रह जाएगा, बट ये छोड़ मत देना अब, बिकॉज आपके 60 डेज में ही तो एग्जाम ये क्लास हुई है। तो आप क्या करो, एवरीडे 10-15 मिनट पत्ते घुमा लो, पीडीएफ आपके मोबाइल में रखो, एवरीडे याद करो कि ये कौन सा डिजीज है, इसके ऊपर क्या याद रखना है। ज्यादा लोड नहीं लेना। जैसे ये इमेज देख ली भाई, ये स्पोरोट्राइकोसिस है, 4 पॉइंट याद कर लो ना दिमाग में। रोज डिजीज है ना, स्पोरोट्रिक सेंकाई है, एस्टेटेड इट्राकोनाजुल ड्रग। कॉन्सेप्ट था दूसरा डिजीज फिस्ट एंड ग्रैन्युलोमा। बस फिर बंद कर लो, फिर जो सब्जेक्ट पढ़ रहे हो वो पढ़ो। तो ये इमेजेस देखते रहोगे और याद करते रहोगे, इट विल बिकम वेरी इजी, स्कोरिंग सब्जेक्ट है वो। वायरल डिजीज, viral disease, first virus we will discuss is the herpes simplex virus. herpes virus कितने प्रकार के हैं? How many types of herpes virus you know? कापोसी सार्कोमा पता है? टोटल 8, HHV 8 है ना, कापोसी सार्कोमा HHV 8, तो 8 प्रकार के तो हो गई। तो herpes simplex virus, what we will discuss, HHV 1 and 2 first. HHV 1 and 2. In this, one causes the orolabial herpes. HHV 2 causes genital herpes. So why I am clubbing this HHV 1 and HHV 2? Because what they will do in a primary infection, suppose this infection is on the lips, right? Orolabial herpes. So what will happen after the primary infection? This virus will go latent for some time, but again and again it will reinfect. So it will go latent into the sensory ganglia. It will go latent in the sensory ganglia, and later on causes the recurrent infection around the same area. Okay. So secondary recurrent infection. When it will cause secondary infection? During fever, menstruation, stress. It can be any kind of stress. Okay. Physical, social, emotional, or a psychiatric stress. Okay. We discussed herpes virus. What it will cause? It will cause secondary anaphylaxis. What was the diagnostic test we discussed? Jank smear. So, on the histopathology of this virus is what you will see. Most common test used is the Jank smear. It is a Jank smear. How it is different from HHV3? When a person has a human herpes virus 3, human herpes virus 3 is a virus. Very toxic of the body. There is a varicella. Okay. So see this image. You just have to identify the image. As you can see, there is a localized fluid blister vesicle, right? These are the grouped vesicle. So the word you will look for is a grouped vesicle. Grouped vesicles will be present. It is also known as a fever blister or the cold sore. It is also known as a fever blister or the cold sore. So we will discuss many diseases, but always remember above the waist. If I show you any above the waist, is herpes simplex and the waist, which is a like this. Herpes HN. Okay. So treatment for all the herpes virus is always the acyclovir. So as a group, you just write down in human herpes virus, drug of choice is a acyclovir. Okay. But suppose this patient who has a oral label herpes, suppose this patient also has a atopic dermatitis. So what is a atopic dermatitis? Person has a atopy. Why they develop atopy? Because of the impaired barrier, right? And because of the impaired barrier, what will happen? This patient will be on the, can be of two type of medicine. The one is the antihistamine, and the second is the steroid. So this is the treatment of atopic dermatitis, right? So if this person is on these two medicine and if he or she develops oral label herpes, now what will happen? This area will expand. The reason is there is no check because of my immunity is low. So it will infect all my face. So it is commonly seen in the children who are suffering from the atopic dermatitis. This condition is known as a eczema. Eczema means atopic dermatitis. Herpeticum means extensive herpetic lesion. So write down eczema herpeticum. So if I ask you what is the causative agent of the eczema herpeticum, what you will answer? Herpes simplex virus type 1, right? Patient has underlying atopic dermatitis or eczema because of immunosuppression patient will have a extensive lesion. The treatment is a IV acyclovir. So you will give IV acyclovir because the disease is extensive. Okay. Third, this image-based question was asked. The history was given that this patient is developed this painful vesicle on his fingertips. These lesions are extremely painful. So if they give you the finger involved with the vesicle, this is known as a herpetic whitlow. And as I told, Remember, it is caused by the HSV1. So this is just an image-based question. It is seen in healthcare workers. It is seen in the healthcare worker because when you are working with the patient and if you are directly came in contact with the herpes virus, it will get inoculated on your skin and will cause the blister. This is a herpetic whitlow. Extremely painful. It is extremely painful. Finger भी swell हो जाएगी और you will notice vesicle. So vesicle will give us an idea that this is a herpes virus. Fourth is a genital herpes. Genital herpes is the most common sexually transmitted disease in the world. It is the most common. एसाइक्लोविर है, सबकी ट्रीटमेंट एसाइक्लोविर ही है, सबका एसाइक्लोविर ट्रीटमेंट. मोस्ट कॉमन सेक्सुअली ट्रांसमिटेड डिजीज इन द वर्ल्ड इज द जेनिटल herpes caused by HSV2. HSV2 is most common cause of the genital herpes. So it is not an absolute rule, but yes, most common is the HSV2. Incubation period is around the 5 days. It is a sexually transmitted this disease is a sexually transmitted during the active disease. Patient will have a grouped vesicle so in the genital area, if the person has a fluid filled vesicle, because of the friction, what will happen? Because of the friction in the genital area, what will happen? This vesicle will rupture, right? And this grouped vesicle will get ruptured causing multiple ulcers. It will cause multiple ulcers. And will it be a painful ulcer? So remember this. This will help you answering question on this. That this will be the painful. Along with that, this patient will also have a lymphadenopathy. Lymphadenopathy is painful on an initial episode. And this will be the non-suppurative. Why non-suppurative? Because it is the virus. Virus है तो non-suppurative होगा, बैक्टीरिया होगा तो suppuration करेगा. So virus है non-suppurative lymphadenopathy करेगा. So because this disease will remain for the years and years. So initial episode during the first 2-3 years, the lymphadenopathy can be painful, but later because of the recurrent infection, it will be the painless. So what is the treatment? Treatment is a acyclovir. Treatment is acyclovir. But why I'm telling you this is a sometime you will require as a prophylactic acyclovir also. Prophylaxis is 6 to 12 episodes per year. So if your patient is having a 6 to 12 episode per year, you will require to give prophylaxis with acyclovir. So when to give prophylaxis? So any disease, suppose she is having a fever of typhoid. So along with the typhoid medicine, what you will give? You will give the acyclovir. The reason is because she has a tendency to develop more genital herpes. So you have to give prophylaxis if she or he is having a high episode of the genital herpes. Okay. So this is about the HSV1 and HSV2. Then comes our human herpes virus type 3, which is a varicella zoster virus. Varicella zoster virus. It is a human herpes virus type 3. Primary infection is varicella. All over the body. Then virus remain latent and then present with a dermatomal line, which is a zostery form. Causing this it can Zinc smear help me to differentiate between HHV1, 2 and 3? Zinc smear, if I take a Zinc smear, can it help me differentiating between HHV1, 2 and 3? No, right? Because all causing ballooning degeneration and secondary acantholysis. So in all this disease, I will not see because all they are presenting in the vesicle. So physical appearance of the disease is also the same. So we will discuss varicella. A few important points what they ask on varicella. You will see lesion after 1 to 2 days of the fever. After 1 to 2 days of the fever, patient will develop papule. Patient will have a papule. And inside this papule, water will start accumulating. And because of this water accumulation, it will become a vesicle. Around this vesicle, because of the inflammation, there will be the red erythematous skin. So, patient will have a red erythema. This appearance is known as dewdrop on rose petal. Dewdrop on rose petal. After this, in this vesicle, there will be the accumulation of the pus. So it is a pustule. And when this pus is, it will become crust. So if I take a one patient of varicella, on his face, I will notice that on his face he is having a papule. On his back, right now, he is having a vesicle, right? And the some area will have the pustule. So in a single patient, I can see many type of the lesions. So this is known as a polymorphic rash disease. Polymorphic rash disease. What is the distribution of the rash, centripetal or the centrifugal? This is the centripetal. This distribution so what is the meaning of centripetal distribution? पेट पे ज्यादा, पेटल पेट पे ज्यादा, फ्यूगल एक्सट्रीमिटी पे ज्यादा. Okay, so centripetal means it is more on trunk than extremities. So centripetal distribution. Dew drop on rose petal, previously asked question. So when this patient is not infective, once the crust is formed, the patient is non-infectious. Patient is non-infectious. Okay, drug of choice is the same, is the acyclovir. Okay, if varicella is in pregnancy, if mother get pregnant and if she develop a varicella, most of this is within 20 weeks of the gestation. Most risk is within the 20 week of gestation. Child can develop a limb hypoplasia. Cutaneous scar. And the neurological defect. This is known as a congenital varicella syndrome. If mother is pregnant and if she is about to deliver and if she develops this varicella 5 days before or 2 days after, so what is this period? This period is a perinatal period. So in this case, when the baby is delivered, so what we will give? We will give varicella zoster immunoglobulin. Varicella zoster immunoglobulin. And for the mother, we will give acyclovir. For mother, we will give acyclovir. So we will, if it is before the 5 days, we will start mother on acyclovir, and when the baby comes out, we will start her on varicella zoster immunoglobulin. Similarly, you also know a mother who is a Hep B positive, right? When the mother are Hep B positive and the baby is born, what we will do? We will give vaccine and Hep B immunoglobulin. That baby do not get this vertical transmission of hepatitis B. Okay. So remember these three diseases: HIV transmission from mother to child, hepatitis B transmission from mother to child. So these are the important two topics. You should know this. So herpes zoster. Herpes zoster. The second name of herpes zoster is a shingle. It is also known as a shingle. After the varicella, virus went into the dorsal root ganglia. And then came out on the dermatome as a zoster. So this is a herpes zoster. So this is a zosteriform lesion. The most common dermatome involved is the thoracic dermatome. Most common cranial nerve which is involved trigeminal. What complication can zoster do? It can cause post herpetic neuralgia, pain after 3 to 4 months of the healing. So the lesion are healed, but persistently patient is having the pain. So most common dermatome, cranial nerve, and complication. For us. Two important signs of the herpes zoster. The first is a Hutchinson's sign. Why this sign is important is ophthalmic involvement. So when you see that vesicle is present on the side of the nose, after 2-3 days, this person can involve the total area of the face involving eye. So what you should do, you will start this patient on a high dose of acyclovir, that he do not get the extensive herpes zoster. That is why Hutchinson sign is important. So if the vesicle is present on the side of the nose, it is a ophthalmic nerve zoster, then eye is usually affected. This sign is known as a Hutchinson sign. This sign is known as a Hutchinson sign. Second is a Ramsay-Hunt syndrome. What is Ramsay-Hunt syndrome? Facial paralysis in cases of the herpes zoster oticus, because the seventh cranial nerve is passing from our ear canal, and because of this, if there is a ear involvement in the herpes, what will happen? It will affect my seventh cranial nerve, and it will cause the facial paralysis. It will cause facial paralysis. Facial paralysis in some cases of the herpes zoster oticus, you will see. HHV4, human herpes virus type 4. What is this virus? It is a Epstein-Barr virus. So, what do you know about the Epstein-Barr virus? Epstein-Barr virus. Anything you know? Any cancer you know which is caused by the Epstein-Barr virus? Shingles occur after the chickenpox. हाँ, बात तो की ना कि varicella होगा after dorsal root ganglia में virus will go into the dorsal root ganglia and then it will reinfect. So this is known as a shingles. Okay. Any cancer you know because of Epstein-Barr virus? Nasopharyngeal carcinoma. It is a nasopharyngeal carcinoma. Any lymphoma you know? Burkitt's lymphoma. Epstein-Barr virus causes two important cancer: nasopharyngeal carcinoma and the Burkitt's lymphoma. Okay. So Epstein-Barr virus. Here we will discuss two important diseases of this. One is the hairy leukoplakia. Epstein-Barr virus HHV4 is an oncogenic virus. It is an oncogenic virus. It causes nasopharyngeal carcinoma, can lead to Burkitt lymphoma. But remember, why I am telling you this is, if you are asked that what is the causative agent of the hairy leukoplakia, okay, hairy leukoplakia, answer is the Epstein-Barr virus. But this condition is not pre-malignant. This condition is not pre-malignant. It is associated with HIV. Most commonly, you will see that on a lateral aspect of the tongue, on the lateral aspect of, you will see hair-like projection. This will be also be the whitish color, but how to differentiate with the candida? That it can't be removed. So in your exam, they say white color plaque which can be removed with the help of the spatula. That white color is a candida. If it cannot be removed, it is a oral hairy leukoplakia. So they will give you this point that is it a removable or not removable. If it is not removable, it is a oral hairy leukoplakia. It is a oral hairy leukoplakia. It heals on its own. It heals on its own. Okay, but here remember, if I ask you what is leukoplakia, so what is the meaning of leuko? Leuko means white, right? Leuko means white. But leukoplakia, it is the most common. It is the most common pre-malignant lesion leading to oral cancer. Okay. So this is the difference. Oral hairy leukoplakia is by the virus, but the leukoplakia is just a white patch in the mouth, which is the most common pre-malignant condition. Second disease, which is caused by human herpes virus type 4. Is a Kissing's disease. Or it is also known as a glandular fever or infectious mononucleosis. So they commonly use these words. It is caused by the Epstein-Barr virus. It is caused by the Epstein-Barr virus. Patient will have a fever, pharyngitis, and the posterior cervical lymphadenopathy. It is a posterior cervical lymphadenopathy. So in your question, what they will give you, they will give you that the patient developed rash after taking ampicillin. So they will give you this history. If the patient developing rash after ampicillin, this is a infectious mononucleosis. For the diagnosis, what you will look for? You will look for the atypical lymphocytes. So the second is a heterophile antibody will be positive. You will have a positive heterophile antibody. क्या herpes का ट्रीटमेंट मतलब जो HHV1, 2 और 3 है वो हमेशा शरीर में रहता है, बाकी के जो है वो रिमूव हो जाता है। HHV1, 2 और 3 ही लेटेंट होते हैं, ये अपने आप ही हिल हो जाता है। herpes as a family is extensive in the environment, HHV1 to 8, but generally they are not able to infect us because we have a proper immunity against it. But HHV1, 2 and 3, they can remain latent. They have a DNA virus. So, see this pityriasis rosea. 3-4 important MCQ. See this. They will ask causative agent. So pityriasis rosea is different than pityriasis versicolor, right? So in the pityriasis rosea, what happened in this patient is, as you can see, a large annular 2 patch will appear, and after this you will see a daughter small patches, and after 1 or 2-3 months you will see that lesion is increased, because this lesion are less on the periphery and maximum in the center area. This pattern is known as the Christmas tree pattern because it is merging into the center, and because of this pattern is known as the Christmas tree pattern. So what are the important MCQ points? The first is what is the causative agent? Is a human herpes virus 6 and 7. This can be the drug induced. This can be the drug induced also. The drug which can cause is a captopril, imatinib, and the interferon. The primary lesion we will see is the herald patch, or also known as the mother patch. This mother patch will spread throughout having a Christmas tree pattern. So this is the second question. Christmas tree pattern is seen in a pityriasis rosea. So this herald patch is a annular round patch. If you see the scale of the pityriasis rosea, it is giving you a hanging curtain sign. Hanging curtain sign. So why the hanging curtain sign? On this annular lesion, when the scale is coming out, it has a outer fixed border. So this border is fixed. Is hanging curtain. So it's fixed, right? You in border is giving okay. 15 मिनट पढ़ लो फिर देख लेते ओके 5 बजे लेते हैं है ना एक बार वार्ड्स खत्म करते हैं वार्ड्स के बाद हमें सेक्सुअली ट्रांसमिटेड डिजीजेस लेना है जो ज्यादा इंपॉर्टेंट है ना सेक्सुअली ट्रांसमिटेड डिजीज से इस बार भी एक क्वेश्चन आया था हाँ वाह भैया इंपॉर्टेंट तो सब कुछ है भाई बट आई थिंक सेक्सुअली ट्रांसमिटेड डिजीज आपने देखा ही होगा कोई ना कोई एक क्वेश्चन तो आ ही जाता है सेक्सुअली ट्रांसमिटेड डिजीज से सो ह्यूमन पैपिलोमा वायरस व्हिच डिजीज इट कॉज hanging curtain sign see this if you see the scale of this pityriasis rosea so I am showing you the photo of this scale can you appreciate that this border is fixed on the skin it is attached to the skin but this border is generally free so these are the flake of the stratum corneum right and because of this scale is hanging on my skin so that is why this rash is a scale is known as a hanging curtain sign this scale is giving me a hanging curtain sign okay human papilloma virus which disease is caused by the human papilloma virus CS cervix but what right it causes warts so HPV is a DNA virus or the RNA virus it is a DNA virus it is a DNA virus it causes elevated hyperkeratotic warts what are the pathological cells present what are the pathological cells present here in pap smear what we look for the poilocytes so remember if you see this word poilocyte it is because of the human papilloma virus or the warts so what is the wart wart is a hyperkeratotic skin lesion which is coming onto my skin okay so देख लो खाली ऐसे warts when it come to my surface there can be the different types these are all our stratum corneum different shape of the excessive stratum corneum so you don't have to know this type but we will discuss what are the positive agent of these warts so if they ask non-genital warts on a non-genital skin we have a most common type which is a verruca vulgaris verruca vulgaris is caused by the human papilloma virus type 2 verruca vulgaris human papilloma virus type 2 So this is on the upper surface. It is a human papillomavirus type 2. HPV2 causes a superficial wart. These warts are the superficial. So they will not be painful. As you can see in this patient, there is a hyperkeratotic rash present, but these will not be painful, non-painful. Okay, these are not painful. These are not painful. Okay, but if it is on my palmar surface or a plantar surface, it is a plantar wart. If it caused by the HPV2, it will be the superficial and it will be the painless. But if it is caused by the HPV1, it will go deep root because of it is a myrmecia wart, and it will become a painful. Myrmecia means it has a very deep origin like this, and the skin, on the skin it will come up like this. And because of the deep origin, HPV1 causes the painful wart. HPV1 will cause painful warts. Okay. Now verruca plana. Plana means flat lesion. Plana means flat lesion. So these will be not as high as the other warts, but these are the simply elevation. Verruca plana is caused by the HPV3 and 10. Verruca plana 3 and 10. So only you have to remember. We already wrote histopathological cells present are the coilocytes. These are the coilocytes. Treatment is very important. Most of the MCQ they ask is on the treatment. So remember, in the treatment you remember two variety: non-genital wart and the genital wart. Do not get confused. In non-genital wart, we will use keratolytic drugs. What we will use? We will use keratolytic drugs. We will use salicylic acid, which is a drug of choice. Drug of choice. And the second is a trichloroacetic acid. Electrocautery. And the third is a cryotherapy. So these are the non-genital warts. Non-genital warts. Now anogenital warts. So which anogenital wart? What is the causative agent of the anogenital wart? In cervical cancer, you know which cause cervical cancer, which HPV? 16 and 18. So 16 and 18 are the severely oncogenic virus. But in anogenital warts, so remember like this, in anogenital wart, there are human papilloma virus 6 and 11. These are the low risk virus. If 6 and 11 is a low risk virus, whereas 16 and 18, it is the high risk virus. Which cancer? Cervical cancer. And 6 and 11 will cause external genital warts. It will cause external genital warts, which is known as a condyloma acuminata. In which disease you will see condyloma lata? Condyloma lata you will see in the secondary syphilis. Secondary syphilis. Condyloma acuminata is seen in anogenital warts due to human papilloma virus. क्रायोथेरेपी लिक्विड नाइट्रोजन यूज करके -196 बहुत ठंडा करके निकालते हैं, बिकॉज एक्सट्रीम फ्रोज हो जाता है कोई भी टिश्यू तो डेड हो जाता है ना, गैंग्रीन नहीं हो जाता. सिमिलरली लाइक दिस क्रायोथेरेपी में हम एक्सट्रीमली लो टेम्परेचर यूज करते हैं. क्रायोथेरेपी इज द मोस्ट प्रिफर्ड थेरेपी नाउअडेज. इलेक्ट्रोकॉटिन तो वो इलेक्ट्रिक नाइफ आती है उससे काट देते हैं, बट नाइट्रोजन थेरापी जो है क्रायोथेरेपी वो ज्यादा अच्छी है. फ्रोज करके निकाल देते, टिश्यू फ्रोज करते हैं तो वो निकल जाता है टिश्यू से. Warts on the genital skin. So as you can see in this patient, if they are asking you what is the causative agent of the external genital wart, okay, what you will answer? 6 and 11. 6 and 11. In the men, commonly these warts are seen on a coronal sulcus and the frenulum of the penis. And in the female, it is seen in the posterior foreshead. In female, you will see this on the posterior foreshead. So how you will identify condyloma acuminata? Acuminata means pointed lesions. Acuminata means pointed. So you will see group and pointed lesion on the glans penis and around the genitals. So see this second photo. As you can see in this image, the pointed warts, pointed grouped warts. This is a condyloma acuminata. Remember like this, acuminata means pointed. A pointed group of warts are caused by the human papilloma virus. Don't make a mistake of answering the causative agent of a 16 and 18. It's an external area you can see. So what you will answer? 6 and 11. Because 16 and 18 causes internal cervical wart. So they cannot give you the photo of that wart because it is in the cervical area. Patient will get to know when it should develop a symptom of the cervical cancer. Okay. So how to prevent this anogenital wart? So you all know which vaccine we give nowadays against the human papilloma virus. Nowadays, vaccine of choice is a Gardasil vaccine. Cervarix was a old. Cervarix was only covering. It was covering 16 and 18 mainly. Whereas Gardasil also covers 6, 11, 16, 18, 31, 33, 44, 52 and 58. But what you should remember is the all main four causes 6, 11, 16, 18. It is mainly covered by the Gardasil vaccine. So that is why vaccine of choice is the Gardasil. Sorry? So 9 वो ज्यादा आइडिया नहीं है, बट पहले क्या था, पहले ओनली 4 स्ट्रेन ही इन्वॉल्व थे व्हेन इट वाज फाउंड 4 स्ट्रेन. बट अब इसमें क्या आ रहा है, दे आर एडिंग द स्ट्रेन्स. अब तो बहुत सारी विद इन फ्यू इयर्स वी विल ऐड फ्यू मोर स्ट्रेन, तो उसको पेंटावेलेंट 6 वेलेंट करते जाएंगे. नहीं, आपको यही पूछेंगे गार्डासिल में 6, 11, 16, 18. 6, 11 का याद रखना है, लो रिस्क वायरस है. लो रिस्क वायरस है, 16, 18 करेगा कैंसर. सो हाउ टू ट्रीट जेनाइटल वार्ड. Treatment of the genital wart, very important. You will see many MCQ asked on the treatment of the genital wart. Drug of choice is a 5% imiquimod. It is a 5% imiquimod. It is a immunomodulator. It is a immunomodulator. Podophyllin and the podophyllotocin. These are the anti-mitotic agent. These are the anti-mitotic agent. So these are the first line. The second line is the same. You can opt for the cryotherapy. Or because the warts, if it is large, surgical excision can be done. Surgical excision can be done. But because if they ask treatment of genital warts in pregnancy, see these medicines are teratogenic. So these medicines are the teratogenic, and that is why if they ask what is the treatment of a genital wart in pregnant woman, the treatment of choice is the cryotherapy. If it is not given in the option, trichloroacetic acid. Trichloroacetic acid. Trichloroacetic acid. Okay. Apart from this, आपको पूरी डर्मेटोलॉजी में याद रखना है which disease causes the centrifugal rash. So what is the meaning of fugal rash? Centrifugal means more on extremity, less on the trunk. So you will remember this mnemonic scars. So what is this scars? It is a Coxsackie virus type A, Rocky Mountain spotted fever, and this syphilis. Rocky Mountain spotted fever. Rickets ऐसे होता है ना? Rickettsia causes Rocky Mountain spotted fever. It is Rocky Mountain spotted fever is caused by the Rickettsia. Which disease is caused by the Coxsackie virus? The disease which is caused by the Coxsackie virus is the hand, foot, and mouth disease. Hand, foot, and mouth disease. Syphilis कौन करता है? It is caused by the Treponema pallidum. Centrifugal rash. So measles है, रूबेला है, वेरिसेला है, जो भी बच्चों में रैशेस होते हैं, फिफ्थ डिजीज, वो क्या होगा? सेंट्रीपेटल. वो सेंट्रीपेटल होगा. सेंट्रीपेटल होगा. ओके, शॉर्ट ब्रेक लेते हैं, फिर सेक्सुअली ट्रांसमिटेड डिजीज चालू करेंगे. हाँ, so we will start by 5:30. We will start after 30 minutes.